We're at the manual hair transplant clinic in Leeds. We're going to go through all the juicy questions with an actual hair transplant surgeon, not just some guy off YouTube, about getting a hair transplant. Let's go. Today we're with a hair transplant surgeon, Dr. Raja. Man is an expert, and we're going to be going through all of the questions relating to a hair transplant, what to look out for, what to avoid, as well as going over my own hair, what he thinks, how they've done. So can you treat me like a patient? I wanted to get my hair sorted out.
Yeah.
How would it work in the clinic? What do I do, where to go?
So the first point of contact is going to be a phone call or an email that you send through the website. One of our coordinators will be in touch and then book you in for a consultation.
So you get the consultation and then you come back in a few months, and then this is where the magic happens.
Yeah, so this is our main theatre where we do the majority of the procedures. So we also do non-surgical treatment here as well, so PRP, platelet-rich plasma injections. We do a lot of those treatments in here and downstairs as well.
Is that something that you recommend after the transplant as well, getting the PRP? And
yeah, I mean, it's a good non-surgical option.
Yeah.
So certain cases where they might not be suitable for a transplant, it's helpful. Or if they're not taking medication for various reasons, then PRP is a good option to look at. I always start by looking at the back of your head first. So, there is scarring there, which is quite apparent when you pull the hair up. Hair at this length, it's not obvious, it's not overt, which is a good thing. So I would say certainly, I've seen cases where the harvesting, even at this length, it's obvious they've got patchiness, but in your case, that's not there, right? So I can see it to my eye because I know what I'm looking for, but the average person, if you're walking down the street with your hair at this length, wouldn't be obvious, but you can see, there's evidence of scarring there. In terms of density, I would say the density is quite good actually, as is often the case with these types of transplants. And given that you've only recently had it, there's no real evidence of progression behind where they've transplanted.
Okay.
You have got some thinning going on here.
on the crown, yeah.
Yeah, in this area here and the crown, so early stages of loss. But if you're on the finasteride, hopefully, we can stabilize that and thicken out some of the existing hairs. I see people often have this misconception, we can transplant into these areas successfully. It can be done if you've got clearance to do that. But because, the hairs are natural hairs and they're quite packed in together, if we were to transplant hairs into this, it would actually end up damaging some of those hairs. So you have to balance that, and actually the best option right now is a medication and non-surgical treatment for these areas here. In terms of coming back to your earlier question, how I maybe would have done things a bit differently, they have created imperfections here, so it's not perfectly straight.
Yeah.
I've seen a lot of lines where it's dead straight and there's not a single hair coming below the line. When you raise your eyebrows up for me, you can see this is just into the muscle tissue, probably a bit lower than I would have wanted to go if I was doing your transplant.
Okay, yeah.
One of the problems you can have is when you're talking, these hairs, you can find some movement in them. So coming around this side, we can see actually here, the line carries on going straight. We would have wanted to taper this a little bit and make it a little bit of a natural recession.
This is probably entirely my fault, because I was like, actually...
You told them what you want.
I went in there, I was like, yeah, make sure it's high and natural looking, and then I was like, they drew on the line, I was like, maybe a mil or two down, so it probably would have been exactly as you said.
Yeah, it's all in the angles, you see, so I would have just rounded that off a little bit into the actual junction that you have there already. But otherwise, you've got good growth coming in.
We've got a load of questions to Dr. Raja. I will go through some of the most asked ones, like the ones that I see the most on getting the hair transplant, the procedure, things that people get wrong, common misconceptions, and things that I think maybe people should probably know before getting it. If someone wanted to get a hair transplant, or they're thinking about it, what should they look out for in terms of selecting a clinic? Like, what are some red flags, some green flags? What should someone do?
I think the most important thing is really do research on the procedure and the type of procedure that you're going to need firstly. Then it comes down to the skill of the surgeon who's doing it, making sure it's somebody who's dedicated to doing hair transplant. And also, of course, the clinic and the facility is really important. So we actually invite patients to come in and have a look around the clinic.
One of the things I was asked as well, I think you'll probably be able to explain this better than me, is if someone asked, if the hair that you're moving is not sensitive to DHT, so it's not going to be miniaturized, and you're moving these hair follicles, why do you have to take medication for the hair if you've moved the hair? Does that make sense?
Yeah, good question. So it's not actually for the ones that we've implanted, it's for the rest of the hair.
Yeah.
Right, so we want to maintain what you have originally. The natural hairs are likely to respond to that. The implants themselves, it's unlikely that they're going to have DHT sensitivity. So it's more about stabilizing the existing hair and trying to thicken out as much as possible what we have around the transplanted area.
Yeah, I think I'll put a picture on screen, but I think the Wayne Rooney example, I don't know if you've seen his hair, but because it's just someone that doesn't look like they've taken medication.
He's an interesting one because, he was one of the first guys to become known for having a hair transplant, right? And he's had several procedures over the years.
Yeah.
And you can see that if you look at the pictures, he started off with just a one procedure, and it classically sort of went through an extreme case of loss where he's lost everything. So what we're talking about, basically, that's an extreme example. But he's just seemingly had more and more surgeries to try and bridge that gap. And ultimately, they've, whatever they could take without it being too obvious, it has been taken and implanted. So that is where things could end up if you're not stabilizing the loss.
What would you say to someone that's young and they want a hair transplant? They're not happy with the way that their hair is.
If you're a 19-year-old and you come into me for a hair transplant, more often than not, I'm going to say, well, listen, it's too early. You come back in a few years' time, see how things go. Let's try and stabilize the loss, right? But there's some cases I have done where people have been 19, where, for example, they've lost almost all of the hair on top.
Really?
There's extreme cases of loss.
Yeah.
And then you're not so worried about the progression because they've already progressed. They will benefit from a hair transplant, most likely. Those patients have come back and they're over the moon with the results, are really happy. It's more important to a 19-year-old to have that hairline than it is to somebody, like myself, perhaps, right? And because they're in that sort of critical period of their life, might be just started university, or it's going to hit their confidence a lot more usually than it would somebody who's in their 30s, for example.
I think if I could have 30% of my hair from the age of 18 to 50, or 80% of my hair from the age of 18 to 30 than be bald, I'd rather have no hair. So
exactly, and most guys will take that choice.
A misconception that I see on social media and other things, especially on my YouTube, is people often ask if because they've got the hair transplant, they think they don't need to take any kind of finasteride or medication for the hair before or after. Your thoughts on that?
Yeah, I mean, a lot of the guys who I've treated who've particularly been abroad to Turkey, or they've sort of had a lower end hair transplant locally in the UK, things like that are not paid attention to a lot of the time.
It's not even mentioned.
It's not mentioned to them. So they'll come back with the problem of the actual hair transplant itself looking unnatural, but they've also progressed in the loss as well. So it's like two problems that we're dealing with at the same time. I think one of the more important things for us is to educate patients on long-term prevention strategy, because transplant should always be a last resort option. If you're able to revive the existing hairs with finasteride, minoxidil, I've seen some amazing cases where we've had an extensive crown loss, for example, and hairline recession, but we've treated the hairline surgically, and we've had them on medication, and they've come back with almost completely full head of hair. And those results, in my opinion, are only achievable if you're using a combination of medication and surgery.
And that brings us to the next one. Do you have to shave your head?
Definitely advantages to shaving it. I mean, it's just generally easier to perform larger procedures if it's shaven, right? But typically what we tend to do, the majority of our procedures are part shaven. So we shave the back and sides down to 0, and then the areas we're implanting, we can leave those long. And that gives patients flexibility to be able to conceal the area that we've treated. Recovery
time. What do you say to patients in terms of recovery time, getting back to training? I think it's a big one, like weight training in the gym.
Yeah, I mean, the good thing is with FUEs, particularly recoveries, you'll have a little bit of itchiness around the donor area while it's healing. But actually you can do your day-to-day activities fine from the following day, as long as you're following precautions and you're careful.
I think it was when the new growth started. Oh my, the itchiness then was absolutely awful. I was in Thailand as well. I was like, do I have an infection? I was worried, but I think is it the actual hairs growing through the scalp when they're making new channels that can cause irritation?
So you do get some shedding, and then you get fresh growth coming through. And that period, sometimes you can see ingrown hairs, you can see some spots forming. Usually they're self-limiting, it settles down on its own.
Because I had a few spots when I got mine, I remember that. And then it's the itchiness, but probably around 2 to 3 months I really started to get it. And then in terms of like going to the gym, weight training, actual exercise, what would you say to that?
I normally advise you can go back to light exercise after 1 week. So nothing heavy for 2 weeks, no high intensity cardio or heavy lifting. After 2 weeks, you can go back to your normal routine.
That's good. I'm glad you said that, because I read a study on graft anchoring. Some places would say, I'd hear such broad and ridiculous things. It's like certain clinics or surgeons would just completely make the numbers up relating to when you can do certain things. So I think I've heard people saying like 1-2 months of no exercise, like crazy. And I'm like, what is the premise for that? So I'm glad that you've kind of...
I mean, I've only ever had one patient who had a problem with that, and that was a guy who's a bodybuilder, and just at 2 weeks, he did a deadlift and he had a small spot of bleeding, and presumably his blood pressure was high and caused a little bit of bleeding, but when he came back for his result, it was absolutely fine. So I think 2 weeks is a good enough time frame.
Any hair transplant misconceptions or myths, things that people think that aren't necessarily true?
I think the biggest one is unrealistic expectations. So people think sometimes we get people come in who are very extreme cases of loss, let's say, and they think it's straightforward to just transplant the whole top of the head.
There's no cure for hair loss, is there?
Yeah, I mean there's no cure or surgery. We're working on things in the background. There's stem cell research and all this stuff going on, and cloning is the other thing that people are talking about, but I think they have this misconception that you can treat it all in one go.
Yeah.
And it's not like that. We have to do it in stages if we're going to get good results. So yeah, that's the most common one, I would say.
Thank you very much, Dr. Raja.
You're most welcome.
If anyone wanted to get in touch with you or your clinic, what's the best way for them to do it?
Yeah, I mean, if you go on the manual website, you go and click on hair transplants, and then at the bottom of the page there's a get in touch box, so you can fill any details. One of our coordinators will be in touch at the earliest opportunity, and then more than happy to see people for consultations and take it from there.
Nice one. Lovely. Thank you very much.
You're welcome.
Cheers for that. Perfect. Okay.